4 years ago this month, the first case of COVID was announced in Toronto. Since then, many have moved on, but new data shows residents in long-term care are still dealing with its deadly impact. Over the course of the pandemic, we've interviewed resident Devora Greenspon many times, and we decided now is a very good time to check in on her.
I have now admitted to my kids I'm an old lady.
No! Dvorah will be 92 in September. Her zest for life surely helped keep her going during the tough times. This was her reaction when she got her first COVID vaccine.
Hooray!
But still, it wasn't easy.
When I think about it, I don't want to relive it. It was a horrific experience. I was in lockdown, or as my kids called it, jail. I didn't see my children for 2.5 years.
Life is better, but COVID is still a heavy presence for all long-term care residents. A report by Public Health Ontario this week shows they're still very vulnerable to the virus. 260 have died of COVID in the last 4 months, and it is by far the most dominant viral infection in the homes. This chart tracks infections since August. The blue lines represent COVID cases. The green, influenza. Yellow is RSV. There have been 850 outbreaks in homes since August. Dvorah's was one of them. Restrictions began before Christmas and were lifted yesterday.
So when an outbreak hits, even now, it's not easy. It really impacts your life.
You can't move around. You only have a certain area where you can move.
Dvorah is looking forward to the future, though. Family is everything to her, and her family is about to get bigger.
But I'm going to be a great-grandmother again.
Good for you.
I'm going to have a baby to hold. I haven't held a baby for 12 years.
Dvorah recently had COVID herself, and she told me she was very sick for about 12 days. Her best advice to everyone? Get your shot.